My name is Gillian Kohn, and I'm from Charleston, South Carolina.
My name is Mark Kohn, and I am also from Charleston, South Carolina.
Axel was born with his eyes wide open. He has been an old soul his entire life. And about 16 months into the parenting game, we knew something was different developmentally. Axel was diagnosed with autism and childhood apraxia of speech at 20 months old. It was a very...
Emotional?
The first thing our pediatrician said, who is one of my very best friends, she said to me, this wait could be 6 months to a year. 6 months to a year just to be seen in a developmental pediatric office to be diagnosed.
Yeah.
So we had to be very
aggressive
about that. And it was the same even with, some of our therapy services. We waited until I think Axel was 4.5 and he was diagnosed at 20 months old before we were given services. If you do not start those therapy services for a child, obviously this is a best case scenario, before they're 5 years old, you lose that window of time when their brains are formative. We spent 11 years coming to terms and dealing with our son's autism diagnosis. And lo and behold, it was the first platform that prepared us for this next diagnosis, which has been so much more difficult.
It started back in October of 2020. I wet the bed, which was kind of a, thing that had never happened before.
A 41-year-old, seemingly healthy man, but you are wetting the bed every night and you were wetting yourself.
My symptoms from October 2020 until we were finally diagnosed
in May 2021,
my symptoms got worse.
When Mark was first ill and we were referred to a specialist, that specialist had the ability to conduct their own MRI on site, or at least within that practice. I feel very certain that in that time, in the 7 months that we experienced a lapse, he would not have lost bowel function, bladder control. The damage that was done in that time, in that lapse, in that wait for a person with multiple sclerosis, there's no turning back.
I'm pretty much numb from the waist down all the time.
You can't even feel my feet.
I know. Honestly, I have really no feeling in my feet. And if I do, it's either like fire or needles. From my perspective, it was like, if I could have gotten an MRI and they could have just said, you have, MS and we need to get you on MS treatment. During that 7 months, I lost a lot.
Early February of 2023, Jessica, a longtime friend, she said, Gillian, I think you would be really interested in knowing a little bit more about this thing. So she told me about Certificate of Need. When I started learning what Certificate of Need actually was, I realized it was one, outdated, very restrictive. And it was like all the light bulbs went off in my head. Ding, 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 ding,
You're like,
ding,
wait,
ding.
no.
That's why we waited 19 months to see a neuropsychologist. Well, gosh, that's why we waited 10 months to have a neurology specialist. That's why all those parents are saying it takes 2 or 3 years to just be consulted and diagnosed with autism. It all made sense to me. I believe that if we have been given in this life difficult situations like this, outwardly difficult, multiple sclerosis, autism, depression, mental health pieces, all of that, if we've been given something like that, the only thing that we can benefit from it is to try to make it good.
At Americans for Prosperity, we are a grassroots-based organization. And what that means is that we look to give a voice in the State House to people who otherwise may feel like they don't have a voice and that they are frustrated at the current situation of, whatever might be going on in their life. And so Gillian is a patient who said, my husband, he can't get access to care. He's having to wait 9 months to get treatment. And so we were talking to her about the certificate of need and why that is. And immediately it became a light bulb for her and an opportunity for her to be able to lean in at the State House. Gillian is also an individual who resonates with me a lot personally. She has a kiddo with a special needs diagnosis, and so do I. My husband and I were sitting in a pediatric office a few years ago, knowing that our daughter needed to go see a specialist to get a diagnosis. And our pediatrician said, I'm going to put her on this wait list, but it's going to be 2 years before she can get seen. And my jaw literally hit the floor. And so we had the ability, thankfully, to drive to another state to be able to get her in with the same specialist that she was going to have to wait 2 years here to see. So certificate of need is when in the healthcare marketplace, current incumbent providers can stop new providers or new medical equipment from coming into an area. And so it increases the cost for patients. It increases the drive time that they're going to have to get somewhere. It decreases access significantly. Thankfully, in the 1980s, our federal government saw that this is a terrible idea. It actually restricts healthcare. And so we're going to repeal it at the federal level. So South Carolina was one of those states that had something on the books that the federal government got rid of. And so my team got behind this and said, we are going to work our tails off to get this done because this is something that's impacting every single South Carolinian, and it seemed like no one cared. At Americans for Prosperity, we cared, and we were willing to fight day in and day out for 2 years straight in order to make this legislation happen. So AFP did what it does best. We knocked on over 60,000 doors in just a 10-day period. We hit the phones and made hundreds of thousands of phone calls. We had a mobile billboard that drove across the state with messaging. This mobile billboard parked outside the State House garage so elected officials saw it every single day as they were driving into work. We hosted town halls across the state. We collected over 16,000 signatures from individuals from across the state and wheeled those signatures into the State House on a wagon, giving a copy to every single elected official, encouraging them to repeal certificate of need. When we were fighting for this legislation at the State House, we were in these committee hearings and we had these bright green stickers that said, repeal Kohn, save lives. The opposition at this point in time wore white stickers that said, save our hospitals. That was something that a lot of elected officials picked up on in these committee hearings. And they said, frankly, the stickers were an easy way for them to figure out when someone was coming up to the well to testify which side they were on immediately just by looking at their stickers. Were they concerned about the bottom line or were they concerned about the patients that they were serving? And so we really saw this groundswell across the state, really leaning into the tactics, the grassroots tactics that AFP has become known for across the country. In addition to what we do on the grassroots side, we were able to lean in to multiple institutions and build a massive policy coalition that was strong, that worked in lockstep on this legislation.
I'm Wes Clymer. I represent York County in the South Carolina Senate, and I introduced legislation to repeal the Certificate of Need law.
I'm Celeste Davis, and I'm here today because I'm a State House representative, and I chair the committee that handled on the House side the passing of the CON legislation.
I'm Joey Hudson with 94.5 WGTA The Answer, and it's just great to finally meet some of the folks that I worked with over the past couple of years in, as a collective group to get this passed.
Marcelo Hochman, I'm a physician, surgeon, and as president of our county medical society, we took on the issue of certificate of need to get it repealed.
I think in life it's very important to come together and be a voice for change. And the only way that we can make change happen is if we all bring our expertise together to unite.
Back in 2021, I was just the interim state director with AFP then, and Senator Clymer went for, frankly, a Hail Mary to get his bill pulled out of committee onto the Senate floor calendar. And I remember we had a conversation in the antechamber, and I said, AFP is in full support. What do you need? Let's go after it.
It really came home to me as an issue when I met with a physician I represent. He's an oncologist, and he and his practice, they wanted to build a new radiation therapy center for their patients. And he said when he went and met with the local hospital CEO to talk about building their outpatient radiation therapy service, the hospital CEO said, "You can't do that. I have the financial resources to nuke you." And so when he told me that story, and then the avarice of this healthcare CEO putting his own financial interest over the welfare of cancer patients in an oncology practice, I'd had enough. We had to fight.
The certificate of need, that permission slip, only benefited the people who already had a CON in hand because they could keep new people from participating. We need the ability to have an independent MRI center that you could go and pay $300 and get an MRI instead of $3,000 to pay an MRI. And at the very end of it all, there was a very small group that would benefit from the CON, an entire state that would benefit from getting rid of the CON.
We have a text line, and so I had the key word con as a text message. They could text that, and it would send them to a website that showed how they could contact their state rep or their state senator, and you guys got phone calls as a result of that. And so I'm very proud of what our radio station and my listeners, the role that we were able to play, and it just shows people that you can make a difference.
I testified for Chairwoman Davis. I felt that she genuinely listened to what I was saying as a constituent. I felt validated, and I think so often in this world that what we all lack collectively when you look at the generalized community is empathy, and I felt like she was very empathetic to my story, and so I knew she'd be empathetic to so many others as well.
It means a lot to me to know that you feel validated and that you feel like your voice made a difference, because it did. Every voice made a difference.
Certificate of Need would not have been repealed if AFP had not played a leading role in our efforts. I'm just thinking back to the early stages in the Senate debate in 2022. Candace and her team led grassroots meetings all across the state. The cumulative effects of all of that activity played an immeasurable role in our ultimately successful effort to repeal Certificate of Need, so thank you.
You really did something this year that's going to benefit South Carolinians for decades. And I can't say enough how much we appreciate you having the courage to do that.
Within 36 hours of the repeal bill passing the House, I got calls from 3 different healthcare providers looking to invest in my district. None of those projects they would not have gotten off the ground. They probably wouldn't have even tried if the Certificate of Need were still on the books.
To be included, my voice, that's just a very frustrated wife. It feels pretty empowering and pretty amazing to know that change can really happen if you use your voice.